In more news tonight, health personnel in Ghana often become vulnerable whenever they are at the receiving end of healthcare. Despite the promised conditions of service for health workers in the country, they are often unable to cater for their fees when they become victims of grave conditions not captured under the National Health Insurance Scheme. Lord Idoasare explores how some healthcare workers survive dire health situations.
Simon Monto, a 38-year-old registered nurse at the Adan East District Hospital, had his life changed forever after an accident in 2017.
It was diagnosed I had spinal cord injury and I was referred to Korle Bu. I was to undergo a surgery, but unfortunately the surgery couldn't come on because there's a clot in my vein. If they want to go do it, I might die. So they need to put me on drugs for the clot to dissolve. And after the clot dissolves, the doctors advise that it won't be necessary doing the surgery again once I'm able to settle well. So I have to move on in life.
Another nurse at the Ashaman Polyclinic, 31-year-old Shine Ado, has had to limp her way through work after pregnancy complications.
It started with a little pain in the knee and then it gradually went into the hip, and now it has affected the two hips. I limp when walking because of the pain, and in the house I actually use a stick in walking, but when I come out I have a support that I work with. That is someone who holds my hand. It has affected because I'm unable to put in much effort than I used to do.
Regional Secretary of the Ghana Registered Nurses and Midwifery Association, Solomon Ajao, says due to the poor working conditions of health service workers, the group has had to come to the rescue of its members.
Today's gesture that we've done to a tune of about 130,000 Ghana cedis to members in various hospitals with various conditions. It is trying in our condition of service that this is what it's supposed to, but in most cases it doesn't come up. The agency or our employers try to institute something, but it's yet to get its final stages for its implementation. So we are hopeful that in the near future, whatever plans they have for we the employees, it will inure to our benefit. Any health worker, being it a doctor, a pharmacist, will not be on radio, on TV stations soliciting for funds.
For Simon, Shine and other members of the Ghana Registered Nurses and Midwifery Association, donations will provide them some assistance.
On behalf of my nurses and midwives, I say I'm so grateful. I'm so grateful for all that you have done for me.
Head of pharmacy at the Ashaman Polyclinic appealed for special attention to be paid to healthcare workers to help them provide better services.
When we are sick, you even go to some hospitals and the queue yourself you have to form. You even, sometimes you wonder whether you are the same person coming back to your facility to take care of patients. So we would have wished that at least we could have some agreements among ourselves in the various facilities. If it's possible, conditions of service can, beside that, it to give us the ability to get whatever service we need as quick as possible, because our duty is to come back and continue rendering that same service to others.